Um, this is a question to Shireen Jejeebhoy. Why do you think it is important to engage with young men and boys along with women and girls when it comes to contraceptive choices, gender discrimination, early marriage and other issues related to sexual and reproductive health and rights?
As the previous speakers have said, as things have been changing, the gap between menarche and marriage has increased. Young people are more exposed to education, to new ideas, to the media, and so on. And so one of those changes is very likely to be increased contraception, increased premarital sex. And I think the problem is that we must, as adults, put away our misconceptions and understand the needs of the young. So let me put this question in context. Currently, about 1 in 5 boys, just less than 1 in 10 girls report premarital sex before they're 20 from the available data. At the same time, over 1/4 of young women marry before they're 18, and many more marry in adolescence. So irrespective of whether we are considering the unmarried or the married, contraception among them tends to be very limited. And knowledge about contraception tends to also be limited. So among sexually active unmarried adolescents, hardly any may want to become pregnant. Yet less than 1 in 5 is using any method of protection, any method of contraception. And clearly this is exposing them to the risk of infection, to the risk of unwanted pregnancy. Among the married, many young couples want to delay or postpone their first pregnancy, but very few managed to do that. And the unmet need for contraception then is much higher among them. So whether or not they have sex is really not a question that should preoccupy us as adults. Rather, what's important is to know and to ensure that if and when it happens, it's informed, it's safe, and it's wanted. But there are, of course, many obstacles that young people face from us as parents and from other adults in their lives.